Okay. So, SMBG is something which is self-monitoring of blood glucose. That's the full form of SMBG, which has to be done on a regular basis. Okay, monitoring for better diabetes health. That's the first thing. This involves regular measuring your own blood glucose level with your glucometer, which is there at home, the portable glucose meter, which is the glucometer at your home. Okay, you have to make sure that you are checking your sugar levels on a very regular basis and not only relying on your blood tests, which happen maybe once a month or once in 3 months, etc. Because when you don't check your blood sugar levels on a daily basis and then suddenly get HbA1c done and get a shocker is much more scarier than checking your sugar levels on a daily basis. I will tell you why. Okay. We basically what does this daily sugar monitoring does? It gives you an immediate feedback of your blood glucose level that helps you to manage your sugars, to manage your diet, to manage your medications, to manage your workouts very effectively. This is a study which is actually done where where there were individuals who were checking their sugar levels on a daily basis, and there were others who were not checking the sugar levels on a daily basis, and um, their results were compared, where we actually noticed that the people or individuals who were managing and checking their sugar levels on a daily basis got better results than the ones who were not checking their sugar levels on a daily basis. So if we are doing something, it is always good that we get results out of it. We generally say कि अगर आप खून दे रहे हैं आपका एक बूंद तो वो किसी फायदे के लिए दें, right? This is for your own benefit. Few benefits of checking your sugar levels on a daily basis, apart from giving you good results, on your HbA1c, is one, feedback. You get your real-time glucose levels, you get your real-time blood sugar, so that you can make changes with your routine and your physical activity on a daily basis. Okay, that is one of the biggest biggest benefit which you can say that you get by checking your sugar levels on a daily basis. So you can implement things where you're going wrong, you can make things, you can change things where you're going wrong on from the very second day itself. Okay, and it also helps you understand why are you facing issues with your sugars. For example, sometimes you feel that you are feeling very giddy, you're having a headache, etc. But you would just assume that it is because that your sugars are dropping. It is because that you feel that your sugars are going in the lower range. But when you check, you might understand that it can be because that your sugars are high too, right? The first thing that we feel that my sugars are dropping, you would immediately reach out to a Parle biscuit, you would immediately reach out to a chocolate. But what if at that very time your sugars are high and you're not supposed to reach out to those things, right? So this is something which we come to know when we check our sugar levels at that very moment. So understand your body, listen to your body's signal, and act accordingly after checking your blood sugars on the glucometer. Okay. Second is your treatment adjustments. Of course, when you check your sugar levels on a daily basis, you will be in a position to, contact your doctor very regularly, saying that, okay, my sugar levels are coming in the normal range or they're going below the normal range. Kindly help me with the change in medications, or kindly help me with the next step, how we can do with the medications. The best thing, what I can give you, what I can say, the best grade here that I can give you is, if you check your sugar levels on a daily basis, you can tell your doctor that, okay, my sugars are coming in the normal range, please stop my medications or please reduce my medications, etc. So that you can get rid of medication. Who likes eating medicines, right? Second is your dietary changes, of course. When you see there are a lot of fluctuations in your sugar levels on the glucometer, you can reach out to your health coach, you can reach out to your nutritionist to help you make changes in your diet. Or you can reach out to them and say that, okay, this is something which I ate and this is how my sugar levels are, which means this particular food is suiting me. Can I continue that? Can I have that? So you will understand if that particular food is suiting you and how changes can you make. Imagine if there is a surprise that comes if you like a specific food. Very simple example, if you like something, a dish like a pav bhaji, If you check your sugar levels after eating pav bhaji, it doesn't spike. If you reach out to your nutritionist and say that I ate this specific food and it did not give me a sugar spike, my sugars are remaining in the in the normal range, what if you get a leverage to eat that? So that treatment adjustments also can be done in terms of medications, dietary choices, and also exercise routine. We understand that exercise is something which is mandatory for weight loss, which is mandatory for weight gain, but it's also equally important when you have to manage your blood sugar levels. The more you exercise, the more correct exercise you do, the better you will be able to manage your blood sugar levels, and the sugar levels will drop also. So depending on those sugar readings that you get on your glucometer, we can also change your exercise routine. We also make it a point that the intensity changes, the intensity increases, reduces, the type of exercise also changes. So you will be able to make different treatment adjustments with regards to your lifestyle, which is your food and your exercise and your medications as well. The other thing is risk reduction. Of course, we know when we have diabetes, or when diabetes steeps in, it comes with added health risks also, like your heart condition, your kidney problem, your neuropathy, your vision changes, etc. When you check your sugar levels on a regular basis and you are at at a mental peace that my sugars are in the normal range, of course the other medical conditions also won't steep in together, right? So other risk reductions also, which is linked to your diabetes, will help you in managing your sugar levels. Other, enhance the quality of life. Of course, improved control by continuously monitoring your blood glucose level and making necessary adjustments, you can experience better control over your diabetes. So you know how. Now, if you've been mentoring, if you've been managing your sugar levels, and if you've been monitoring your sugar levels on a daily basis, you will yourself understand that where and what changes can be done in your regular routine, in your food lifestyle, so that you don't, change, or you do not increase your sugar levels. For example, you have to go out for a dinner, but you've checked your sugar levels throughout the day. Today, you will understand what all can I choose for my dinner, outside dinner today, right? So this is one of the added benefits of your checking your sugar levels on a daily basis. Reduced anxiety. Of course, SMBG reduces the anxiety about unpredictable sugar levels or sugar swings that you get. The first thing which I said, suddenly when you, after 2 months or 3 months, if you get your HbA1c checked and if it's suddenly high, that is definitely going to give you anxiety. So it's better to check your sugar levels on a daily basis so that you don't get that anxiety attack after 3 months, right? Overall, of course, overall health is also improved. If your sugar levels are controlled, automatically other medical conditions are also at place, and you might not even gain as much weight. Now, how do we do it? How do we do this? How do we do your SMBG? Everyone has different methods, but these are some standardization which has to be followed, where you have to first start by washing your hands with soap and water, ensuring that they're clean and dry. Okay, if your fingers are moist, if it is not cleansed well, so of course the dust particles, the water can, give you faulty readings. Make sure it is clean, it is dry. Load a sterile lancet into the lancet device. Of course, in your pen, you can always load a lancet. One lancet can be used 3 times. After that, you have to dispose the lancet. Okay, insert a fresh strip into the glucometer. Use the lancet device to prick the side of your fingertip and obtain a small sample of blood. Most of the time, we've seen that we end up pricking at the center. Always prick at the side. Okay, and you can adjust your the lancet machine, the lancet device, to a 2 or 3 depending on the thickness of your skin. Sometimes when you adjust it to and you prick, there is no blood. What you would end up doing is you would just end up pressing your finger and then getting the blood out, right? That is not the right method of doing, because if you do that, you are mixing your interstitial fluid, which is the fluid between your muscle and your blood together, diluting your blood. That will also give you wrong readings. Okay, so make sure you adjust the lancet device in such a way that with one prick you get enough drop of blood. Okay, gently place that blood on your test strips, okay, on the glucometer, and the glucometer will display some readings. Of course, on the glucometer, it will display a reading. Make sure that you are logging those readings. It's not that we've seen the reading, okay, correct hai, high hai, low hai, rakh diya. That is not how you're supposed to do. Always maintain a diary, a log, or you can, or in your any app, you can always maintain that diary in your app and log in your sugar levels over there. So when you have to refer to the previous readings, you can refer that as well. Okay. How frequently that you have to check, I mean, frequency and timelines to check your sugar levels. How frequently can you check your sugar levels? It totally depends on the type of diabetes that you have, the level of glycemic control, or what your HbA1c is, what is your management strategy, okay, and completely depending on what your individual doctors also say and what other medical conditions also you have, right? This is one of the thing that we follow at Sugarfit and which works best for all the all the patients that we handle, be it type 1, type 2, type 1.5, etc. When you have diabetes, when you have type 1 diabetes, you have to prick multiple times a day before your meal and at bedtime, so that according to those sugar levels, you can take your insulin doses. Correct? Second, when you have type 2 diabetes and you're on medication, if your HbA1c is less than 7.5, you have to prick daily, compulsory. Okay, if your HbA1c is between 7.5 to 9, you have to prick twice daily. Now that twice, what we recommend is once you can prick at the fasting sugars, which is a compulsion. And second, you can always check your sugar levels after a particular meal. Can be after breakfast, lunch, and dinner. What I would recommend is that check on a daily basis after different meals, so you know how your sugars are reacting throughout the day. Okay, if your HbA1c is more than 9, then you have to prick daily thrice or more times, depending on whatever your healthcare provider or your nutritionist or your doctor has recommended. But checking your sugar levels at least once or twice a day becomes mandatory when you know that you have type 2 diabetes. Okay, now type 2 for maintenance after your meal, how you have to check your sugar levels. Now, when you have type 2 diabetes and you know you are in the maintenance phase, which means you reached your sugar levels up to say 5.7 or even 6, and we have to maintain that sugar levels, you have to make sure that you're checking your sugar levels 120 minutes from the first bite of your meal, which is 2 hours from the first bite of your meal. Okay, type 2 diabetes, and when you want to reverse the diabetes, you have to check your sugar levels 90 minutes from the first bite of your meal. Okay, 90 minutes from the first bite of your meal, which is 1.5 hours from the first bite of your meal. When you are pre-diabetes and you want to reverse the diabetes, which means if your HbA1c is between 5.7 to 6.5, you have to check your sugar 60 minutes from the first bite of the meal. This is for post-meal sugar check. Okay. How do you interpret your SMBG result? Okay, there are different ways where you can interpret, but we have to make sure that our sugars are always remaining in the normal range. Okay, there are 3 ways. One is normal, high, and low. Normal sugar levels, of course, fasting sugar levels have to be maintained between 80 to 100 is the normal blood sugar levels at fasting. And post-meal sugars have to be maintained between 100 to 120, which is the normal sugar levels for post-meal. That is the normal range. High, which is hyperglycemia. Okay, when your sugars are elevated, when your sugars after the meal is above 120 or at fasting is above 100, which means we have hyperglycemia, we have high sugar levels. Third is your low sugar levels, which means hypoglycemia. When your sugars drop below 80 are termed as hypoglycemia. Now, let me tell you this, low sugars are more dangerous than high sugars. So make sure that you are not fasting yourself too much, that it takes your sugar levels to the lower range. Okay, and keep your sugars checked very regularly. If you get any low sugar symptoms like profuse sweating, shivering, headache, uncontrolled hunger, etc. Check your sugar levels first and then take your action, because like I said, these can also be signs and symptoms of high sugar levels. These are the tips which you have to, manage while testing. You have to understand while testing. Wash your hands with warm water. Use the side of the finger, like I said, to avoid that pricking, to avoid pressing your fingers for blood. You can always use the side of the finger, wash your hands with warm water so that your blood circulation increases in that finger, and the blood comes out easily. You get the drop of blood very easily. Set the pointer at the range of 2 to 3 to prick, so that your blood, you get the drop of blood very easily. Keep the test strips covered, dry dry and in packaging. Do not keep them or leave them open, or do not partially shut the box of your strip. Make sure that it is very well tight, and also make sure to check your expiry date before you check your sugar levels, because even if the strips are expired, it will give you the wrong reading. Okay, do not freeze or heat your strips. Okay, that is something which is not recommended at all. One more tip what I can add over here apart from these is that if you feel after washing with warm water also the blood drop is not coming, what you can do is, after washing your hands with water and soap, just shake your hands 5 to 6 times vigorously, so that the blood circulation in your fingers and your fingertips increases, so that the drop of blood comes out very easily. Okay. Now, practical tips for success of self-monitoring blood glucose. First is establish a routine. Consistency is the key. You have to.
Bhakti, so sorry to interrupt. Could you just reshare the screen, because we can see the scribble on there. So if you could just reshare it once, it would be great.
I'll do that. Is it better?
Yes, thank you, Bhakti.
Okay. So consistency becomes the key. What I generally recommend to a lot of my users, that make a table for yourself. When you make that table and when you make a routine for yourself, it becomes easier for you to manage your sugar levels. It becomes easier for you to check your sugar levels also. That after brushing my teeth, the first thing I have to do is, check my blood sugar levels in the fasting. And after 2 hours of my meal also I have to do that. One quick tip what you can actually do is, if you feel you're not able to get that into a routine, always keep your glucometer in a place where you are going to be there at that particular time when you want to check your sugar levels. For example, if you want to check your sugar levels before your breakfast or at your fasting time, either keep it near the bathroom where you keep your brush, but closed, intact, and very well packed so that it doesn't catch moisture. Or what you can do is, you can always keep it at a dining table, because that's where you're going to go sit and have your breakfast, right? So that is something which you can do. Get this as a part of your routine, like how we have eating food as the part of our routine, right? Second, keep a records. Like I said, always maintain a manual, either a written manual in a journal, in your phone, in an application, anywhere, but just keep records of what sugars have been coming, which is going to be beneficial for you only when you look back towards what happened wrong or what went correct. Apart from that, you also have to keep a record of what food do you eat, and what workouts do you do, what medications are you taking, because by just giving a reading, sometimes becomes very confusing, because one fine day, if you see a reading of 180 mg per dl post lunch, you should know why that 180 mg per dl post lunch came. So it's always mandatory to keep a record of your food, medication, and exercise as well. Okay, communication with the healthcare providers. Just do not blindly keep a manual for yourself. Whenever you visit your doctor, or whenever you are going to, have a consultation with your doctor online or at the Sugarfit platform. Make sure that manual is with you and you share that with the doctor so that he or she can help you with the changes needed. Correct. Meal planning. Yes, SMBG can help you understand how different food affect your blood sugar levels. Now you can use this information to make your dietary changes as well, right? When you know that you ate a particular food, if that is, for example, if you ate a biryani and that has spiked up your sugar levels, we have to understand that the rise in that biryani is something which has affected your sugar levels. You can always speak to your dietitian, you can speak to your healthcare provider that this is my favorite food, I eat this and my sugars spike up. Please help me modify the meal. So this is how the healthcare provider will be able to help you modify your meal which you're having right now. Right. Other emergency preparedness, always carry a source of fast acting carbohydrates, tablets, maybe glucose tablets, Glucon-D, sugars, fruit juices, Gatorades, etc. with you, or maybe a small toffee or something also with you if you're always on the go, to avoid the situations where your sugars go in the low range. Whenever you're traveling outside, if you are with your friends at least and your family, do inform them that you have diabetes and there are possibility that you might have low sugars also, which is very common. Let's not shy out, right? And these and explain them that if at all you feel that I am facing low sugars and I'm not able to do this, you can always tell them that your bag has a bottle of Gatorade or my pocket has a chocolate. You can always put that in your mouth and I'll be all fine. Correct. So these are the basic preparations which you actually have to do, and you have to make sure that everyone around you is also prepared and ready to help you everywhere. The best thing that that helps you reverse your diabetes is a good support from the family as well. Sometimes when you have high sugars, low sugars, it's the family support which helps you. So always involve your family, involve your friends who can help you, with giving you better options for food, or with giving you motivation, helping you out and accompanying you with your workout routines, etc. So if you keep them informed that you are checking your sugar levels on a regular basis, and these things will be necessary in the future when you are with them, or at present when you are with them, it becomes very easier for you to manage your diabetes.
Great. Thank you so much, Bhakti. It was such a wonderful presentation, and I hope everyone gets to understand the importance of SMBG going forward, and hopefully they also get into a routine of doing this regularly.
I'm sure,
right?
yes.
So there are a couple of questions in the chat box, but we are now taking up questions, everyone. So if you have any questions, that you want to ask, please go ahead. You can leave your questions in the chat box, and we will take it up. Right. So there is one question that which they're asking: is there like a good brand of glucometer that we can go for, or what would you say?
So you can always you can go for any brand of glucometer, but not taking any specific brand names, but just check that the glucometer